Hello, everyone. I'm gaveling into order the meeting of the Joint Committee on Children, Youth, and Families. Welcome, everyone, both who are participating in this meeting, as well as those of us who are watching us. This is the third and final of our interim meetings for the Joint Committee. As you may be aware, we only meet during the interim sessions, and the work that we do during the interim is then shared with the General Assembly via a letter from the committee and some recommendations about action to be taken by the standing committees. Today, we are hearing a presentation on a number of our childcare topics, specifically from MSDE. As you know, if you've been following over the course of this interim, this has been an issue that we've been very much interested in. We're going to have some presenters again from MSDE, and I will have my co-chair will be introducing all that and handling that portion of our meeting today. And then we're going to have a discussion among the committee members about our letter and also the recommendations that we will be making to our standing committees. So again, welcome all of you, and take it away, Delegate Kelly.
Thank you, Senator Washington, and thanks again, everyone, for joining us today. So we're very happy to have representatives from MSDE here today. We have, I believe, Dr. Deanne Collins, who is the Deputy Superintendent for Teaching and Learning, Stephen Hicks, who we have heard from many times on this topic. Thank you for being back here, as well as Justin Dayhoff, who we've also heard from. Oh, and Ari Amerikaner, I hope I got it right, who is the Chief of Staff over at MSDE, who we've also heard from in the past. Thanks for being here. Who would like to go first?
I guess I'll kick us off. My name is Dr. Collins, Deanne Collins, and as mentioned, I'm the Deputy State Superintendent for the Office of Teaching and Learning at the Maryland State Department of Education. Happy to be here today, and we really appreciate the opportunity to connect with all of you today to provide some updates during your roundtable discussion on childcare. Thank you again, Senator Washington and Delegate Kelly and members of the Joint Committee on Children, Youth, and Families for allowing us some time to speak with you and meet with you today. We are truly committed to looking at our existing practices, but also making enhancements wherever possible to improve the customer's experience in all the facets of our work. So we are really appreciative that you've allowed us some time to come speak with you today. Just in terms of what we're going to talk about today, you can go to the next slide. Specifically, we're going to provide additional information on the Child Care Scholarship Program and share with you information about how we're improving the customer service and share with you some of our next steps. We're going to share with you some of the supports that we are working towards and have put in place for the early childhood workforce, and also an update on the American Rescue Plan Stabilization Grants that we are coordinating for childcare providers as well. So again, happy to be here. We'll let you'll see the rest of the team will be presenting with me today. So with that said, I will turn it over to Stephen Hicks to kind of continue the presentation.
Thank you, Dr. Collins. You can go to the next slide.
Can I interrupt you for a second, Stephen?
Sure.
I want to note for the members of the committee and those people watching that Senator Washington and I had a very wonderful meeting yesterday with Superintendent Chowdhury, and I just wanted to note he wasn't able to be here today because he has a prenatal appointment he had to attend, but we had a great conversation with him and really appreciated his willingness to respond to our committee's questions and to send this great team of all-stars to answer our questions. So just wanted to note that and thank him for that meeting, and go ahead and proceed with your presentation, and thanks for all your work.
Sure, absolutely. Thank you, Delegate Kelly. Thank you, Senator Washington, and of course the entire committee, and your ongoing communication that you have provided with us, and also the opportunity to always respond. First and foremost, I want to share that the Child Care Scholarship Program in Maryland provides financial assistance with child care costs to eligible working families. It's this kind of support that families depend on so they can work. Next slide. We want to outline in this presentation some of the processes used in the program for you. For example, if a parent submits a complete application, our vendor must pend it within 5 days. This means the application is initially screened for all documents, and the vendor must then approve or deny the application within 10 days. If after pending this application, it is determined that there are missing documents, the vendor issues a missing document letter to the parents. The parent then must submit the missing document no later than 30 days after initial submission of the application. The vendor must approve or deny the application, again, within 10 days of receiving the missing documents if they're received no later than day 30, day 25, or by day 35 if they are received between days 26 and 30. So it's a little bit complicated, but if they receive it a little bit later, there's an additional 5 days for review. Next slide. We wanted to share with you some of the most common reasons for denying an application. We're doing this analysis and we'll continue to do this analysis each month. But the most common reasons for denying an application is that the family does not meet the eligibility requirements or has not submitted the required documentation for a complete application. Sometimes proof of child support has not been included as well. But some of the top 3 reasons from highest to lowest that the application are denied are, again, missing documents, proof of child support, and the parent might be over income or the family might be over income. And some of the top 3 missing documents are proof of identity, proof of income, and proof of residence. So based on this analysis, our communications plan is going to focus on how do we help parents to not make these errors in their initial application. So if we can solve that, those applications will be approved much quicker. Next slide. So we wanted to share with you a little bit about our process. And as I stated, the parent has until day 30 from the time of the original application submission to provide also all missing documents. So this is really common in most states, such as California, DC, Massachusetts, and Virginia. And I wanted to have a little bit of a comparison about this and also a little about the comparison of eligibility. As you can see, Maryland is in pretty good shape in trying to get as many parents qualified based on eligibility for the scholarship program. Many states provide parents with 30 days to give them enough time to supply the missing information. If we were to shorten this to 15 days, as suggested in one of the questions, it would be challenging for some of our families to get that documentation in on time, especially some of our more vulnerable families. However, we recognize that we can work to be more efficient in the review of applications, and our data shows that about 30% of applications received in September resulted in the issuing of scholarship. The major issues were, as I shared, missing documents, parents that weren't eligible by income, etc. But we are going to really look closely at the reasons, again, why these denials are happening and how to go on the front end to communicate properly through webinars, videos, focus groups, etc., to support parents in successful completion of the application. Next slide. So MSDE reviews the application forms to make sure that we are collecting the minimum required information needed to authorize eligibility. These are federal requirements that we must meet. In early next year, we are committed to conducting some regional and diverse focus groups to improve our customer service. Our goal is to get as many parents qualified who are eligible into the program and get those vouchers so that they can provide the scholarships to their kids so they can attend early child care services. Our staff are trained to walk a family through the application process. As part of our focus on equity, our documents are translated in Maryland's top 11 languages spoken, with interpretation services available as needed. Next slide. We have seen a high volume of applications this year as we are recovering from the pandemic and as parents are returning to work. But typically there always is a surge in the fall as kids return to work, vacations are over, parents are returning to their activities. Next slide. I'd like now to turn to the parent invoice process. So that was mostly about applications on the parent side. Now this is the provider invoices. So providers may submit invoices for payment the day after the end of the 2-week service period. Correctly submitted invoices are processed by the vendor within 5 business days. Payment requests are then sent to the comptroller to disperse the funds. Direct deposit payments are received by vendors in 7 to 10 days, and paper checks are delivered through the Postal Service, but that will add additional time, and delivery varies across the state. We encourage as many of our participating childcare providers to sign up for a direct deposit, as they will be funded much sooner. Next slide. MSDE is taking steps to improve our customer service. We provide updates on our websites when there is new information. And we also leverage social media and our bi-weekly Tuesday Tidbits newsletter and our quarterly impact newsletter. The vendor is required to ensure adequate staffing to handle increases in applications and invoices. The new paperless case management and provider payment processing system has minimized the loss of paperwork. Those are some of the customer service improvements that we've already started implementing. Next slide. To provide better customer service, our vendor has incorporated a toll-free number and interactive voice recognition, or IVR system. Voicemails, emails, mail, and faxes received before 5 p.m. on a business day must be returned within 3 business days. During our transition period for the new vendor, we will continue to issue corrective action documents and letters if the vendor does not even respond within 1 business day. Excuse me. Sorry, my light went off. The corrective action process is an opportunity for our staff to work with the vendor to improve customer service and processes. Later on, these corrective actions will lead to financial penalties to the vendor. Next slide. MSD updates posted and distributed FAQs when there are programmatic changes to the program or requirements. Parents receiving temporary cash assistance may work with their local social services office for in-person assistance, and then also families that are in Head Start interact with their program, and those programs work with us to help them complete their applications and become qualified for childcare services through the scholarship program. MSD is currently also piloting a Use the Link campaign. The pilot enables both parents and providers to submit their questions via completion and submission of an inquiry form. The provider and parent inquiry links prompt the customer to provide the minimum information needed for the customer service representation and the representative to be able to respond accurately and without having to make multiple outreach attempts to support that parent. If any services are reduced or terminated due to the parent no longer having a qualifying activity, such as working, or they have higher income and do not need as much childcare services, the providers are given a 15-day notice and the parent is given a 45-day notice. If that is not given in time before services are discontinued, the provider is paid an additional 5 days. Just for clarification, I see Delegate Ebersol's hand up. Are we doing questions? Do you want to do questions during the conversation or a presentation or at the end?
I think we'll hold the questions until
Okay.
the Delegate Ebersol will be first in line. So be prepared.
Excellent. He's an eager.
That's what I was going for. Thank you, Madam
Okay.
Chair.
All right. Thank you, Delegate Ebersol. Okay. Next slide, please. So here are some of our next steps. So we're really looking at customer improvement all along the way. This is constantly on our mind. To improve the application process experience, we are working to improve reporting and analyst capacity, enhancing the IVR, and automate such things as filling the form request. So sometimes a parent will just call or email and say, oh, I need this form or that form. And if we can automate that, that means those customer services representatives can take another call from a parent that might have an issue of they are not quite sure which document they were supposed to provide because they got a missing letter document for example. Next slide. So beginning in February, customers needing human interaction, some really a lot more technical assistance and support in completing their application are going to be able to interact with family navigators. We're really recognizing that some parents need more support in successfully completing their application and submitting all the required documents. These will be located at our regional childcare resource centers. So these are across the state, and we hope to be able to reach folks that need those services, and we will distribute family navigators where they're needed. So for example, there may be a region that doesn't have a high population or a high need for family navigators, whereas another region that's more populous or has populations that may need translation or other kind of supports, they may have more family navigators. But we want to be strategic and thoughtful on how we use this new resource. Also, the family and provider portals that we'll be launching in phases between March and September of next year will provide better support for both providers and families. And for the families, they're going to require that they upload a document as they go through the process. So they can't not upload a document. There can't be a missing document. Now, we can't be sure that that's the right document. We still have to review it. But I think that can alleviate any missing pieces of paper, any documents that might be missing. We're also going to require that they watch a video to use the portal so that they're given good consumer education information before they go forth with either submitting a voucher if you're a provider or submitting the application if you are the parent. Now, we also hold regular listening sessions, but we have not done enough in the area of customer service surveys. We are currently developing provider and family surveys to assess customer experience at various levels and in order to make improvements. We plan to employ surveys monthly throughout the state, asking a variety of different questions to find out ways in which we can improve the customer experience. We also want to hold focus groups, as I mentioned before. Next slide. A little bit on the workforce. MSDE supports the workforce in really important ways. Many of you know that we have the Child Care Career and Professional Development Fund, which provides financial support to early childhood educators to earn an associate's or bachelor's degree and cover the application and testing fees required for the Child Development Associates or CDA degree. In addition, the Child Care Credentialing Program awards one-time or annual bonuses to early childhood educators as incentives to reach higher level qualifications and help with retention, recruitment, etc. Teachers in private childcare settings that choose to participate in Maryland's public pre-K program or the pre-K expansion program will earn comparable salary and benefits to school teachers. Next slide. Another way in which we support the early childhood workforce is around the Blueprint for Maryland's Future. With this expansion of pre-K for 3- and 4-year-olds in a mixed delivery system, the pre-K expansion grants fund both private providers and local school systems. In both programs, lead teachers are required to hold a P-3 certification, but as an alternative, they can be enrolled in an approved alternative certification as they work to achieve a P-3 certification. One challenge is that the Blueprint for Maryland's Future does not allow a teacher in a childcare setting to complete their practicum to get a teacher certification in the childcare program in which they are working, unless it is a non-public school. Next slide. We wanted to share with you, because I know you've been concerned, as is Mr. Chaudhry, with the decline of childcare providers in Maryland. Like other states, we have seen a decline in the supply of family childcare especially, but also centers over the last 10 years. There were 10,828 providers who closed or were suspended over the last decade, and 9,326 of those were voluntary closures. Next slide. Some of the reasons for these closures include retirement from the field. We have an aging workforce, especially in the family childcare system. There were increases in requirements required by the reauthorization of the Child Care Development Fund. That's our federal funding for childcare that programs had to meet. For example, the training requirements and the criminal background checks. COVID caused a few closures, but as you can see from the previous chart, closures were even higher prior to COVID. Some providers moved out of state, and then some family childcare providers, which make up 2/3 of our childcare system, return to the workforce. For example, a woman might operating a family childcare program in her home, and she does that because her young children need childcare as well. As soon as those children enter school, she may return to the workforce. Also, some family childcare providers and centers experience low enrollment, so it just is not economically viable to continue. Next slide. Finally, we want to share with you an update on our ARPA grants for the childcare stabilization. We're pleased to share that we were able to get out $158 million in the first round of the ARPA childcare stabilization funding grants to 5,182 childcare providers. This was well ahead of the strong recommendation from the U.S. Department of Health and Human Services, where they wanted states to get half the funding out from the Stabilization Fund grants by mid-December. And we're also ahead of a lot of states. Some states are just now posting their applications. Out of a total of 5,757 applications received, about 90% were valid. Some of those were duplicate applications. Some were from participants or, folks that were not registered or licensed.
I was just jumping in to make sure you knew that Justin was on, if you wanted to hand him.
Sure. Justin, would you like to
I saw you looking for things.
Sure. Well, just I think Stephen certainly got it here, but we the $158 million made it out through the door to providers, as we had intended through this effort. One thing to note here, of course, is Stephen's starting to talk about, for the providers who were not granted as part of that initial round, most of that was due to either duplicate applications or licensure timing. There were certain restrictions in the law associated with the first round about when providers had to have their license and when they had to be eligible by. And so providers who, for example, might have opened or reopened and received that license over the summer, for example, might not have been eligible because they had to be have their license prior to March 11th, which just to benchmark that timeline, that's, because this is part of ARPA funding, right? That's right around when ARPA was signed. So that's where and why we have about 90% with successful application. Now, we do recognize that there are almost 7,200 childcare providers, and we certainly hope in future rounds of the stabilization money in particular to continue that outreach and engage an even broader base to try and get these dollars in the hands of those providers who are still working through this. Next slide, please. All right, well, look at that. To that end, I'll pass it over to Ari here for a second, and then I think we're all around for questions.
We are, and I don't have a lot to add, as is evident by the questions and comments slide up here, but I did want to make 2 or 3 points. One is just for anyone who happened to be watching who wasn't here for the last time that we were joining this committee. I should have thought to flag at the top that this whole presentation was a follow-up in response to questions that the committee sent to us. And so some of the basics, I think, were intentionally skipped over. So those basics could be found in the first presentation that we did a bit ago. So just for reference there for a more full picture. And secondly, I just wanted to thank Stephen in particular for all the work he has done on this over the years, and just being a nonstop leader and advocate for this work in the agency and in the state and in the country, frankly. And then lastly, I wanted to just say, and I know that Senator Washington and Delegate Kelly can attest to this as well, how deeply personal this is and deeply committed our superintendent is to this work and to working together with you all on this. I mean, he is just laser focused on how do we make this work and make this work well for our families and our communities, and is really excited about having a partnership with all of you.
Thank you so much. We have a couple of members with questions already. So first we will hear from Delegate Ebersol and then Delegate Krebs. Delegate Ebersol.
Thank you very much, Madam Chair. And by the way, you deserve recognition. I heard Mr. Hicks reference the somewhat expedited way of getting people certified. And I know you worked very hard on that bill. And that's going to help get people into the profession a little faster. Good work there. I have 2 questions, if I may. The first one is a more general one. I was looking at slides 4 and 6 about how people apply, and also then the sort of the deadlines. And it says, Maryland, you use mail, email, or fax. Now, there are some people who only have the first of those 3 available to them when applying. So that definitely slower, but given current post office problems that are documented and do exist, are we finding that a lot of people are doing it by mail, first of all? And then when they're doing that, are they having trouble meeting the deadlines due to the vagaries of the recent post office slowdowns?
So I don't have that data on, how many parents actually submit by fax or email or mail, but I can get that to you.
And because I worry that, it's a good thing to know, because they might have some difficulty with, I'm personally, some letters are showing up a little later than I would like them to.
Yes.
My second question is, and I'm going to take this away from Delegate Solomon because it's his bill, but I'm familiar with it. He pushed through a bill, and we worked very hard on the bill last year to create some incentives for family child care centers, 3 sets of 3 incentivizes for the regional child care resource centers. And I'm curious if anyone is beginning to take them up, and because you talked about numbers going down of child care centers available. Is any jurisdiction taking that up, because they have to offer matching funds to create and help get off the ground family child care centers in their jurisdiction?
So you're talking about GoFCC, Delegate Solomon. I see Delegate Solomon nodding his head. Yes, we are very excited about this project, and Montgomery County provided a wonderful model over 2 years as they implemented this. And what we have partnered already with the network for our resource centers, which is Maryland Family Network. Now, the bill was passed, and the law, I should say, requires the awarding of 3 grants at $150,000 apiece for GoFCC in FY23 in September. We know that we have this American Rescue Fund. We know that we have a huge need to increase the supply of childcare. So part of our strategy in the American Rescue Act Fund is to start with some planning grants. So Maryland Family Network has had some informational sessions for jurisdictions that want to participate in this, and soon they'll be having their applications and have folks apply for planning grants that will begin early next year. And then from those planning grants, those applicants, those recipients, or anyone else, it'll be open for everyone, can also apply for an implementation grant. And in FY23, we expect to make at least 3 by September of 2022.
I am muted. Thank you, Madam Chair. Sorry.
Excellent. Let's hear from Delegate Krebs.
Thank you, Madam Chair. First, Steve and your team, I wanted to thank you for all of the follow-up from our last meeting. Our last meeting, I
Great.
think there was a lot of consternation by many of us and many members of the childcare community. And you provided us great answers to many of the questions that we posed. At least we've got something to work from. And I really appreciate, this was definitely a lot of time put into the handouts that we got. And I certainly appreciate that. And I appreciate the enthusiasm about customer service. That was, just sometimes what you think is happening, it's different on the ground when we're dealing with it and people in the field than what you think is happening. So I appreciate you taking that to heart, and please respond to Dr. Chaudhry that we appreciate this. But a couple of things that you have in your next steps. You talked about family navigators, customer service satisfaction surveys. And I've noticed this through our unemployment, I call it debacle, that we've had for the last couple of years. Many, many people, especially low-income people, do not have the access or the technological ability to do some of these things. It sounds simple, like uploading this and uploading that. And I just wanted to see I know you mentioned the video, and I appreciate that, but whether there's going to be technical support for folks, because some of the stuff, even for people that are, it's tough to do. You don't might have a scanner or whatever. So I want to make sure that we have the technical support. And you talked about the in-person availability for certain human interaction for TCA grantees and Head Start grantees. But is there opportunity for human interaction for everyone? And if there is, whether it's by phone or in person, are responses available after hours? Because a lot of what we heard last time is these people are working and they don't really have access during 9 to 5 to get on the phone with someone to help them. Is there going to be after hours? That's my one question. I have another simple question after that as well.
Great, thank you for those questions. So let me just say a little bit I appreciate those and agree with you on making sure that we have equitable access for all families. So very briefly, for TCA customers, they can go into any social service, local social service office. They can, as they're applying for health care or any other social services, SNAP, etc., they can also apply, and the customer service agents there will ask them about childcare needs. Excuse me. And then right there, we have trained our partners at the Department of Human Services to support families in completing their application and either sending it to us or copying the materials for the parent and helping them to send it to us. So they also provide those. For the Head Start families who are all eligible because they're in Head Start, they've already done that eligibility check. The Head Start providers can help them right there to get those childcare services, because Head Start is typically a school year, but families need it after school, before school, and also in the summer.
I was particularly interested. I see they're taking care. I was interested in outside of those two programs.
Yeah, so
people that don't fit.
Yes, so outside of that program, what we envision is our family navigators that are located at the regional centers. They'll have open office hours. They'll take appointments. And families can go there to those regional centers, which typically do the professional learning opportunities for our childcare providers and family childcare providers and teachers. They will help them with that application. We also want to strengthen kind of on the ground with each of our childcare providers to be able to support their families. So if they see a family, especially if we increase income eligibility or Build Back Better passes and more families are eligible, those childcare providers can actually support, and they do right now, but not all of them, families to complete the application. Now, childcare providers should not be submitting the application for the parent. And it has a lot of sensitive information there, but they can assist them in knowing what the documents are, answering questions. So I think if we do a better job on training our folks in the field, our childcare providers, to support their own families and future families in completing the process successfully, that will also get to that, touch experience that families need.
Thank you. And I have one follow-up question, if you don't
Sure.
mind. And you might have to get back to us on this. And I noticed on the handout, you didn't talk about this in this presentation, but in the letter dated December the 9th, one of the questions that was asked on page 9 was, what will be the impact of losing current providers, of losing pre-K to the public schools through the blueprint and through some of these other programs? And what will be the impact on curriculum for faith-based providers? Many of our, especially in Carroll County, of our providers are part of churches. Now they're non-denominational, people come non-denominationally to these, but the answer that was given was faith-based providers who choose to participate in this pre-K can offer faith-based curriculum before and after the 6.5-hour instructional day. And that was just a concern. And I just like you to follow up on that later, because many of these programs, I mean, it would put our preschool population almost out of business in our county, because most are housed in schools and have some type of faith-based curriculum. And I don't know that they'd continue if it had to be after the 6.5 hours. So just want to understand if that's, coming from federal law, state law, blueprint, because we were assured all along that it would not affect those providers, and they're all over our state. So just want to, it's something I just would like to understand better, maybe in another opportunity, how that's going to impact our current providers. Because again, in our county, it's going to take a substantial number of our seats away if that goes through.
Sure, I appreciate that question. And my mother is a retired minister in the UCC Church. I will get back to you on that. I think there are similar legislation in the blueprint, similar to the Boost program, for example, but I'll get a more comprehensive answer for you. I will say that in our pre-K expansion grant, we have faith-based preschool providers that are able to participate in the program for that school year, the 6.5 hours, and they're also able to provide the religious instruction that they want to have their young children receive before school, after school, at other times outside of that 6.5 hours. But I'll get a better and more comprehensive answer for you.
Yeah, I mean, right now that would be disruptive to how they give their programs. But thank you so much.
Sure. Mm-hmm.
Ms. Krebs, if I could just add another comment to what Stephen was talking about in terms of the support. What I also hear that you're getting at is like the user experience, right? Beyond just surveys and things like that. So one of the things that we are also doing, and which I've already done, I was a director in Montgomery County Public Schools prior to coming here, and I oversaw early childhood. So I've worked with partners, I've looked at, mixed delivery and all these issues. And one of the best things to really understand the user experience and figure out how you can enhance your customer service is to be a customer, right? And so I've already done that. When I was in my prior position, I was like, all right, sit down. I'm the customer. I'm going to pretend I am filling this out. And I was like, holy crap, like we got to change this, right? And so we're doing the same thing here. We've already done that here. Let's experience it to see what tweaks we can make, what are some quick wins. And we've already begun to do that. Steve and I will actually be going out to do, along with Mr. Chaudhary, but on our own, some site visits to actually interact with folks, talk, and to see the user experience. But I just wanted to point that out because beyond getting feedback on a piece of paper, some people don't fill it out. I mean, really being out there in the field and talking with folks and getting their voice, to me, honestly, I have found that is a really, really high quality way to work on some process and systems improvement. So I just wanted to elevate that to you all to let you know that that is going to be one of our standing practices as well.
Well, thank you. You're speaking my language and I appreciate it, but just keep in mind the technology divide between many people. And listen, every one of the legislators sitting on here knows what I'm talking about with unemployment. And just some of these people, I mean, literally I can't even tell you, my hairdresser, I thought she was going to die. She didn't, to try to upload a form to somebody. So just keep that in mind. Not everybody's at the same wavelength. It was difficult for people that are technologically able to do things, much less not able. So thank you. I really appreciate your enthusiasm.
Yeah, thank you very much, Dr. Collins, for adding that in. And I will reiterate that we heard the same thing from Dr. Chaudhry, and really, really appreciate this enthusiasm. Let's move on to Delegate Solomon.
Mute myself there. Thank you, Madam Chair. And it's good to see you all. I apologize for being a couple of minutes late. I'm on a work trip, so trying to wedge everything in one day. But Stephen, it's good to see you, Ari, and Dr. Collins. I just wanted to say thank you. You all have been just great partners in working through complex issues and helping us solve local issues that pop up, and appreciate, I know, having been on the other end of this in a previous job, working in a school system, how hard it is to get all the answers and do everything. So appreciate the effort that you and your team have put in all of this. Did have a couple of questions, and I did want to mention, one of the recommendations we have, and I know I've talked to you all about it on the presumptive eligibility front. I've had some really positive conversations with national folks, and so I'm excited to talk with you all because I think we figured out how to make it happen. But I did want to ask on the payments for providers piece and the data that you submitted, is that data that's currently there, the process that's listed, or is that sort of the what's supposed to happen? Because, and I think I mentioned this to you all before, like that there just does seem to be a disconnect a little bit from what we're hearing from providers on how the payments are processed. And I don't know if it's an issue on the MSDE system side, whether it's the comptroller system, whether it's another payment process system within, DBM. But I think it's something I know my colleagues and I on the Appropriations Committee would really like to get to the bottom of. And if we need to fund more PINs and get you the resources to make that happen, or whichever department it is. So I was just curious for some clarity on that slide.
Sure, you're talking about slide 9 that we shared about the invoices paid to providers.
Yeah.
And yes, that is the process. We are going to better analyze the data to see why it is that possibly the invoices are not completed correctly. If that's an issue, also if it's an issue that when they're received, they're not processed within those 5 days as is required or a corrective action is issued. So we're going to do a couple things: analyze that data more closely, see where the mistakes, if there are mistakes, where they occur, and at the front end, try to do what we're talking about with the families, the parents, to provide better consumer education on how to appropriately or properly submit, fill out, complete invoices. So I think there's probably a lot of onus on us to do that work of analyzing and finding out whatever the error is, how can we try to prevent that from happening in the first place? Because our goal is to get more and more providers to accept the child care scholarships so that more and more families have access to quality child care prior to entering kindergarten. And it doesn't matter. I mean, it matters if it's our fault, but it doesn't matter if it's someone else's fault. We need to solve that problem. So we're going to do the hard work on trying to do that.
Okay, great. And then the next question I've got, and this may be for Justin as well. So we've given out about 180 million of the 300 for the provider support grants within ARPA. What's the plan to get the other 120 million out? And then obviously there's the $200 million pot. Do you have any sense of when we're going to see more concrete plans, or what sort of the buckets look like that's going to be distributed?
Yeah, absolutely. And actually, just to even, if it's okay with you, Delegate Sullivan, to follow up a little bit on piggybacking on the end of Stephen's comment there. I think as Stephen's talking about those processes, it's worth noting too that we are working actively. When we talk about customer service, it's across all aspects of the department, right? And so from a fiscal perspective, thinking through as well on systems and people and process, how we can make sure that at the end of the day, our fiduciary responsibility as an agency is to the children and families of Maryland. And so keeping that in mind with all we do with our fiscal processes is something that we're considering as well. To that end, moving ahead with both the stabilization grant as well as the additional $193 million, which I believe is what you're referring to, that was part of that ARPA receipt. Sort of two different questions, if you will. The first piece, it's about, in total, about $138 million that will go out through round 2 of the stabilization grants. Our plan all along, including when we first started talking about this, was to provide these payments in early 2022. And we are indeed on track for that. So I would say, we expect to be providing updates very shortly as to that plan. Our goal overall, of course, is to, just as with the first round, get this into the hands of providers as soon as possible. One of the things that we are doing as part of that process is taking the feedback that we've had from providers, including some of the conversations in the last hearing, and indeed related to some of these questions, to make sure that even between these two parts of the same grant program, that we are making the application process easier. We're taking time right now just to do refinements on the actual physical application, to anything that we don't need, take it out. Let's get this money where it needs to go, with the intention of the law is, with the intention of all of our, all of those who appropriated those to us, right? So that we can get those out to providers. And so I think that the first answer is that the plan is to get, still on track to get those out early 2022. We look to be making some announcements about that, perhaps even before, right around the new year here. So in the coming weeks.
And so, Justin, just to be clear, so it sounds like there's going to be another set of, it's going to be another application. It's not just going to be sort of a redo of the first round. Okay.
Yeah. Yes. In part because, and this actually speaks to one of the questions we provided. We are structuring the awards slightly different, in a slightly different way than the first round, which is to add, to continue to provide support to all of the childcare providers, first of all. So everybody will receive dollars through round 2, to be sure. But in addition to that, providing some of the allocation through a series of equity considerations, if you will. And this is what we're working to finalize as a department right now, right? If you serve infants, for example, and toddlers, giving a little, supplementing that allocation. So we're constructing that in its whole, and gaining and garnering feedback on that from providers and from provider associations before we release that, because we want to make sure, whether it's a systems and process piece from the actual application part, right, and all of that, to actually understanding and being in line with the formula and the math and the actual funding itself, that we're doing that hand in hand with those who this is going to go out to. And to that end, though, also being mindful of time and trying to do this expeditiously. So staying on track with our early 2022, I'd say look for that very shortly. A second piece of your question, I would be remiss if I didn't answer your whole question, if you don't mind. The $193 million. I want to thank you all. As a legislature, we actually received that appropriation signed from the governor just this week. So as part of that budget submission, the budget amendment submission, I should say, we are at this point with that timing going to move ahead implementing the aspects of that budget amendment, part of which Stephen already spoke to with some of those planning grants, for example. And so I don't have the full budget amendment in front of me, so I certainly don't want to give you any incorrect or incomplete information. So I'm happy to respond after this if you'd like any more detailed plans for how that's laid out. But in the interim, though, again, feel free to, that's in the budget amendment package with the spending plan that we laid out there.
Thanks. Yeah, it's, I've been traveling, so I didn't get a chance to read it. I saw that it came through. And then the last question I can follow up with you on, but I think as you probably will see, and I think some of us have mentioned this before, there's, we're working on potentially, provider new hire and retention bonus, and would love to follow up with you on some data so that we can figure out what the amount looks like there, and that we're doing something that will actually move the needle on bringing new staff in, making sure that we don't lose more. I'm constantly reminded of, when you look at Starbucks and, other jobs that are paying, $2,000 bonuses. I mean, I was in a Wawa the other day and it's like a $2,000 hiring bonus and, they're paying $16 an hour. We want to make sure we're keeping our staff. So I'll follow up with you on that. But thank you, Madam Chair. And again, thank you to the whole MSDE team for your help.
All right, I'm looking for any further questions from members. I don't see any more hands up. I do have 2 questions myself, but if we have any more questions from members, now would be the time to raise your hand while I ask my question, which was on slide 17. So I think it's for Stephen, but whoever can answer it, really has to do with the closures over the last decade. So I just wanted some clarity, because what we see, of course, is since 2012, which is when the numbers start on slide 17, a significant number of closures over the years, mostly voluntary, not due to enforcement actions. My question is, what does the data look like for new childcare providers opening, right? How do we have that information?
Sure. Yes. Do I have it right now? No.
I mean, just like the basic trend, right? How does it compare
Yes.
to closures? Is it a net loss? Is it a huge net loss?
Oh, I would say offhand, there is a net loss. And so what I can provide though is a similar data that shows the openings over the years. But when I look back at historic data, for example, Delegate Kelly, from prior to me coming here, so 10 years ago, Maryland had like upwards of like 12,000 providers, and now we have 7,200. Now, there's a lot of different factors. Yes, closures because of different reasons, people moving out of the business, but there's also been an expansion of services for 4-year-olds in school systems, for example. So there is less of a need for those slots, or less of an opportunity or such for those slots in a private childcare provider setting if those 4-year-olds are being served there. Plus, as you know, Maryland prior years ago, before the Thornton Commission enacted mandatory required compulsory education beginning at kindergarten and full day programs, our private providers were doing that work, right? Providing kindergarten and also pre-K. And then we had a requirement for full day pre-K and full half day pre-K for economically disadvantaged families, and then full day required kindergarten. So that changed the dynamics a lot. So there's a lot of factors that come into play in there, but definitely we have seen a huge decline that is not kept up with the reopening or creation of new programs.
So I guess my follow-up to that, if we're looking at, roughly a 5,000 loss or so over that time period, my question is sort of what can we do to support these businesses administratively, right? I know out of the last meeting, and this was really very helpful, the provider associations met with Michelle Eberly from the Maryland Health Exchange, and they're working together to come up with ways that they can promote getting access to subsidized health insurance for their employees. That's obviously healthcare is one of the things that we heard they definitely need access to, but I would imagine also just administrative functions, right? Running a small business is very hard. What can MSDE be doing to help these providers? And also what other state agencies should we be looping into this conversation, like that partnership I mentioned with the Health Exchange?
Yes, I thank you very much. And I just got off a call prior to this with Montgomery Moving Forward and got an opportunity to hear those same kind of concerns that you're bringing up. And so I think those partnerships across agencies are going to be very important. Labor, commerce, et cetera. And also our federal partners, right, to support this. Now, we have this terrible tragedy of the pandemic, but this Arpa funding is going to provide an opportunity for us to support better support our childcare system. And one of those ways around this $193 million in discretionary child care development fund funding is through supporting this concept of shared services. So how do we provide those accounting services, education on good business practices, to our childcare community, especially family childcare. So that is one of the things that we have an opportunity here out of this terrible situation to be able to support our early childhood community and providers. And you'll be hearing more about that, and we'd be happy to report back on that progress.
Excellent. Thank you so much. We have a couple more questions now. Senator Hedelman, then back to Delegate Ebersol.
Thank you very much, Chair Kelly. And I just wanted to follow up on your line of questioning, which is, and maybe I didn't see it in this presentation, and I can't recall if it was within the last one, but since there has been such a precipitous reduction in the number of childcare services available, I wonder if you can tell us what the gap is between the need that's out there and the services that are provided. And as a follow-up to that, it seems incredibly important to me, especially at this point in time, to be able to kind of look out predictively and to look at whatever we think the birth rates might be coming up, or just looking in the past and making predictions going forward. And what is it we need to do within the marketplace? Also taking into consideration the changes as a result of the blueprint to anticipate what services we need to provide to fill that gap.
Those are all excellent questions. Thank you. So I would say we probably need to do a better job on finding exactly what some of those gaps are, but I will tell you without question that our biggest gap is enough infant care that is affordable, right? So with with the ARPA funding, we're hoping to be able to address some of those issues. We are very thankful to the legislature for your work over the last couple of years in increasing the child care scholarship provider reimbursement rate. When I first started here, that provider reimbursement rate was at the 9th percentile, which meant that it really wasn't being very helpful for most families, and especially infant and toddler care, right? So now at the 60th percentile, I think that is helping families better afford infant care, but there's a real challenge in our private child care settings in that it's still very expensive because we have such low ratios. So we're going to be looking and exploring ways in which we can allocate some of our CCDF infant and toddler set-aside funds to support the way in which we've supported pre-K, right? It could be the same kind of grants/contracts to support those slots for infant and toddler. I think paired with the Go FCC legislation, that can be a nice alignment, create new families child care programs, for example, and also fund those infant and toddler slots for families in need. I think that's the biggest issue. The other gap that we have that we know about is sufficient services for private child and resources for private providers to meet the needs of children with disabilities. Another issue is to meeting the needs of multilingual children. And these are all high priorities for the superintendent. We have, over the last couple of years through our PDG Birth to 5 grant, supported resources to support children, for providers to know and have the skills to support children with disabilities and to support multilingual children. And with our ARPA funds, we plan to expand those opportunities. As far as the predicting and birth rates, I think that's a really good suggestion. So we should partner with those folks that do that research on birth rates and see what that need is. I will say that we already know in Maryland, there's not enough childcare available. We have many childcare deserts, areas where there just is no childcare. I think that Go FCC is the easiest way to try to get more available childcare, because it's a lot more difficult to build a whole center, childcare center. It's easier to work with an interested individual who wants to set up a childcare program in his or her home to offer those services, as long as they can get the kind of supports needed to both provide developmentally appropriate and safe practices and run a business, because those are really separate skills that not everyone has both of, and yet you need them for a family childcare to thrive. But thank you for those suggestions, and we can look into the predictability feature of birth rates.
Does that answer all of your questions, Senator Hedelman?
I think so. I'd just like to follow up with one thing. I mean, my oldest is 29 years old, and I worked on childcare issues, back when, and infant care was the highest priority then you couldn't find
Mhm.
them. So, I mean, we know these issues have been around for a long, long time. And I guess there are folks who are collecting that kind of data and being able to just be more planful and mindful, I think would be really helpful. But appreciate your answer and your work. Thank you.
Delegate Ebersol.
Thank you so much, Madam Chair, for letting me to double down a little bit here. I'm back on slide 14 of the presentation, if you will. And actually, I referenced it before because bullet number 3 refers to Delegate Chair, we'll say in this setting, Chair Kelly's initiative. But I'm looking at number 4, and it has me a bit confused. It says a blueprint for Maryland's future does not allow a teacher to complete the practicum and child care program unless it is a non-public school. I wasn't entirely sure there was practicum in child care. I thought maybe in pre-K, but also I'm not clear if that's saying that you cannot do a practicum if you're in a public school. You can only do it if you're teaching in a non. So can you just unpack that a little bit for me so I understand it a little more clearly?
Yes, I'm sorry if that was not clear. What I was trying to convey is that if there are alternative certification programs, they must be conducted. Your student teaching, for example, must be conducted in a public school, or if you're thinking of childcare, they must be conducted in a non-public school. And that is in the legislation in the blueprint, in the law. So if, for example, we wanted to support childcare teachers going through an alternative certification program where they could do this for 18 months and they would, they already have their bachelor's degree and they get guidance on instruction. They have a mentor teacher. And of course, teachers getting a teaching certification, as you know, have to do a practicum, right? Student teaching of some sort. So our idea, our plan was that they could, the childcare teacher who's already in that childcare setting and can't just quit her job to go back to school and do that, or work for free as a student teacher, they would actually be able to do their student teaching in the childcare program that they're in with a mentor teacher, providing feedback, observation, improving the practice, etc. But the law does not allow for a teacher to do, a childcare teacher to do that practicum in her own, in a childcare setting. They could do it if she were in a non-public school. Yes, she could do it there. But the law,
childcare setting in a non-public school can be done.
And yes, it can be done there. It has to be either done in a public school, private school, or a non-public school. Yeah.
And Stephen, if it's okay to jump in, just for clarification, that non-public is like a specific category of school,
yes,
not just any non-public school. It's within our teacher certification definitions. So that may be part of the confusion, Delegate Ebersol.
right.
Just to clarify, though, the way this reads is that you couldn't do a practicum if you were working in a childcare in a public school setting. Because it says you can't complete a practicum unless you're in a non-public school setting. Is that accurate?
I see the concern.
Do I have an accurate interpretation of it, or am I just going around in circles with the words a little bit?
I'm not sure, but if the practicums can, the law states where a practicum can be done.
Okay.
They can be done. They can be done in a non-public school. They can be done in a public school. It does not say they can be done in a child care setting.
Unless it's a non-public school. Okay, I got a little reading to do, and blueprint. I have to go back and flip through my 200-page book.
Right.
Thank you, Madam Chair, for your indulgence. I appreciate that.
No, absolutely. And I think, tell me if I'm correct, Stephen, that the distinction is in a non-public school, it would be in an educational school system setting, not in a childcare setting in a non-public school.
Yeah, the difference is also, yes, and part of it is that a private school can be a non-public school, and a child care center can also be a non-public school, or it can be not a non-public school. Does that make sense? Not a non-public school, that's double negative. That's not right.
I think I get where you're at. Yeah.
Yeah. So there are some childcare programs that are also classified and meet not only the child care regulations, but also meet the regulations to be classified as a non-public school. And part of that is that you aren't just offering services for birth to 5, but that you're also providing kindergarten instruction. And so lots of childcare programs do not offer kindergarten instruction also, so they cannot be classified as a non-public school.
Thank you for that clarification. Really appreciate it. I had one
Thank
final
you for
question.
unpacking that. And thank you, Madam.
Absolutely. I had one final question, unless we see any more hands pop up, related to something Stephen said a minute ago about childcare for children with disabilities. I know that we have the flexibility in the law to provide a higher subsidy rate for children with disabilities. Is that something that we utilize?
Yes, I don't know what the rate at which it is, but what you're referring to is when providers are accessing the child care scholarship program, they can get a higher percentage of that scholarship fund added on to provide services for children with disabilities as identified and as needed. I don't have the data on how many actually access that. And we also, just to mention, we have for higher quality programs a tiered reimbursement system that is higher. So if a provider has to be enrolled in Maryland Excels to accept children on scholarship, because we want them to be, higher quality programs for those more vulnerable families and children. So you have to be at least enrolled in Maryland Excels. But if you're in Maryland Excels levels 3, 4, and 5, you get an extra tiered reimbursement above that regular scholarship amount that can be really helpful in supporting that higher quality program.
And so that you have a higher tiered reimbursement if you are supporting children with disabilities as well? Is that what I'm understanding?
And then on top of it, there's another percentage if you apply for it for serving a child with disability.
It would be wonderful if you guys are in constant communication with us, but next time you come back to us, if we had some more information on
Sure.
how many people are utilizing, how many programs are utilizing that, and maybe if we can do some more to promote that, because I know this has been a challenge for parents of children with disabilities. Thank you.
Got it.
I don't see any more questions. So with that, on behalf of the committee, I will just say thank you all for being here to answer our many, many questions and for all of the work that you're doing. Anything else from Senator Washington?
Nope. Thank you so much. Thank you.
All right. Well, I guess I'll pass it off to you and we'll move on to the recommendations discussion part of our agenda.
Yes, we will. We will. Feel free to stay or, walk about the cabin, folks from MSDE. So everyone, we have an opportunity to talk for the next 40 minutes or so about, we've heard a lot over this interim, this last 9 months, and time for us to figure out what we're going to actually suggest to our standing committees. I think one of the things we found is as the Joint Committee for Children, Youth, and Families, particularly with COVID, our interests and our work is expanding across what has historically been the purview of this committee. And we've intentionally looked at things like workforce. We've intentionally looked at things like long-term care. We're having a broader understandings of children and families, thinking of both what happens in the early days of life when we are caring for children, what are happening of us in our middle stages, and also at the end. So the full developmental stage. However, so we've got 3 buckets that we've made recommendations or that we've considered. And so I'm going to ask the staff to read through the first bucket, which is about, we first started out talking about mitigating the economic impacts of COVID-19 on women and families. And then the second one on long-term care. And then the bulk of the time would be on our child care recommendations, because there are very specific ones that I believe there's strong consensus on very specific actions that we would carry through. But the first 2, I'm going to say, just as not as a caveat, but just as opening, that these are broader and that these, I believe, are issues that we need to address in our standing committees and see how we can explore these and lift up these issues when it comes to the impact, disproportionate impact of COVID on the specifically female workforce in long-term care. So staff, if you would start with the first ones and read through, then we'll discuss, and then we'll do the second and then discuss.
Sure, thank you, Madam Chair. So I'll start by reading this off. This is how, for your consideration, how the Joint Committee's recommendations would appear in the summary letter to the Legislative Policy Committee. So this first section is titled Mitigating Economic Impacts of the COVID-19 Pandemic on Women and Families, and it relates to topics that were covered in the September 8th meeting of the Joint Committee. So this first write-up says, in response to the economic impacts of the COVID-19 pandemic, which has disproportionately affected women and families, the state should take the following actions. So first, invest in programs that support the caregiving workforce, which is predominantly female and largely women of color, that struggles with severe workforce shortages and faces difficulty recruiting and retaining employees, including programs that improve access to health insurance, childcare, and long-term care. And then the second item for this group is to ensure local management boards receive adequate state funding to provide supportive services and other programs to children and families.
Okay, so comments, thoughts, how do we feel? Is there a consensus there? Are there things we want to pull out? Just looking. Let's take a minute. And we're not voting today because these are important. We'll just talk about them. So if there needs to be adjustments, we can still do that.
We're just, Madam Chair, we're just on the first part.
Just
correct?
the first part. You just want to, because as I said, these are broader conceptual. The other ones are very much more specific. Yeah.
Anything we can do to build up those local management boards. You know, I'm kind of biased there. A lot of activity around COVID and the pandemic has really gone through those organizations.
Okay. Again, I don't want to imply that you know the silence is that there's consent there, but it just sounds like that there is. Could I say that there is consensus on these two bullet points when it comes to this topic area? Is there anybody that would want to block consensus on that? Okay, great. The second, let's do long-term care.
Okay, so for long-term care, this was the topic that was covered in the Joint Committee's October 6th meeting. And it reads as understanding the widespread implications of the COVID-19 pandemic and what it has done to children and families in the state. The Joint Committee makes the following recommendations to strengthen long-term care, which is directly connected to nuclear and extended family well-being. The first item reads, support legislation that aims to enhance the state's efforts to shift the balance of funding for long-term care services toward home and community-based services and innovative payment models to support these services. And then the second item reads, support the continuation of Appendix K flexibilities that allowed family members to be paid as staff and allowed community providers to support people in their homes and other alternate locations.
Okay. Thoughts about these two?
I will just say, Senator Washington, I think these are great. I like that they're broad. I happen to chair the Committee on Health, Occupations, and Long-Term Care in the House. I know that there are some meaningful and substantive things that we're going to be doing this session that fit right into these large, broad bucket bullet points. So.
I think my only, and this would be to staff, is the term shift. I think we would all believe there is not enough. So I want to make sure that we're not taking away from the long-term. We're implying that we want to move money that we spend in long-term care facilities immediately and just shift it because so I'm not quite sure how we, if shift the balance of funding means taking away from our existing long-term care facilities and transmitting that same amount of money to home and community base. Could you give me an interpretation of that?
This could be rephrased. I mean, support legislation that aims to enhance the state's efforts to support, I mean, I know support's a lot, is in there a lot, but, or I know rebalance is another term that's been used before, but we can work with that wording and try to, tweak it a little bit based on what you're describing now in concept.
Does the committee agree with me that at least I wouldn't want to apply that I want to take existing resources away from institutions because they're already under-resourced, as it is. Okay, I see nodding of heads. Already, great. Okay, so now into childcare. So Delegate Kelly, you've been carrying the ball for this, so you're going to carry it the rest of the way.
I will do my best. I will say that Delegate Solomon had to hop off the call, but a number of these specific recommendations were the ones he referenced earlier in the conversation as well. So I want to make sure to give him full acknowledgement there. But why don't we have Anne, I think, or Emily, whoever was reading off the recommendations, we can go through these and talk more specifically.
Mm-hmm. Yes. So starting with the childcare section. This was covered in the Joint Committee's November 10th meeting, and of course, the beginning of this meeting. So it would read as, the state should take the following actions to improve and support childcare in Maryland. First, resolve the childcare scholarship program payment delays affecting low-income families and childcare providers. And then the second item reads as, require MSDE to modernize and streamline the childcare scholarship application process for families and providers by, and then it has a subpoint, creating a step-by-step video to explain the application process, creating a list of frequently asked questions in each language for which the Child Care Scholarship Program application has been translated, and reducing processing delays by offering training to providers on the Child Care Scholarship application process so they can engage applicants that consent to having providers assist them. And then I'll pass it along to Emily for the remaining recommendations.
Oh, well, maybe we should just say, maybe we just start with those, or these two. I'm sorry, I gave it the chair and then I took it back. Let's just have a conversation.
Is everyone okay with those?
Yes, I think is everybody okay with those? So then we just can keep going. Awesome. All righty, go ahead.
All right, so the next item is to fully explore the ability of states to allow for families to be presumed eligible for the Child Care Scholarship Program, giving them the ability to immediately enroll their children in care while MSDE reviews their paperwork and a formal approval is pending. The next item is expanding categorical eligibility. With categorical eligibility, a recipient eligible for one benefit is deemed to be eligible for another benefit. So recipients of two benefits, the temporary cash assistance and supplemental security income, are currently categorically eligible for the Child Care Scholarship. So categorical eligibility should be expanded to other programs such as supplemental nutrition assistance program benefits, special supplemental nutrition program for women, infants and children benefits, rental or housing assistance, and Pell Grants or other institutional aid. The next item is establishing a fund for childcare providers who accept the Child Care Scholarship vouchers to provide new hire and retention bonuses to their employees, and a fund that would provide new hire assistance to childcare providers. Support the Growing Family Childcare Opportunities pilot program established in chapters 437 and 438 of the 2021 legislative session, and provide additional funding to expand the pilot program statewide and distribute grants for local pilot programs quickly. The next item is explore creative licensing flexibilities to expand access to childcare services, including the establishment of childcare centers at long-term care facilities, hospitals, and retirement community campuses. The next bullet is encouraging partnerships between the business and childcare communities, such as Montgomery Moving Forward and the Research and Action Lab in Delaware. The next item is expanding the childcare workforce by increasing state investment in training programs and quickly implementing chapters 243 and 244 of the 2021 legislative session, which I believe was altering childcare center teacher qualifications. And then the final item is support revising licensure requirements for organizations that provide childcare to school-age children, such as the Boys and Girls Club or groups funded by LMBs that currently require an equivalent license to daycare providers to operate, but generally serve older children.
So that's all of the recommendations that we came up with that were pretty specific. Many of those things we just had a discussion on. Do we have questions or comments from the members on these recommendations? Or anybody want to weigh in?
Let me guess, Delegate Ebersol.
Hey, it used to be you, okay?
Hey, I know.
Thank you, Matt. That used to be you is not the proper way to address you. Thank you, Madam Chair, I think is the correct answer there. I'm looking at the second of page 2. I think I'm on the right page, second to last bullet. I believe this is the Jared Solomon's legislation, expanding the child care opportunities one. I want to make sure I have the right one there because I don't have it in my head as a chapter. I have it in my head as a
the pilot program. Yes, that's
right.
The one we just discussed. Yes.
Right. Okay. So support, but maybe with an eye toward growing that program. You know, in other words, after getting information from the pilot, maybe we can grow that program if it works out well. That's really the most eloquently I can say that, but I'm sure you can come up with something.
Does the second half of that bullet address your concerns, provide additional funding?
Expand the pilot program
to the pilot
statewide
program?
and distribute grants for local programs. Yeah, okay, I'll take it.
I'm happy to strengthen it if you can come up with a way. I'm
No.
all for it, but
No, I think that it does. Yes, I think that'll do it. Yeah, great.
Okay.
No, I'm happy. Thank you. I'm a little embarrassed I didn't see that. Okay, so
it's a lot of words on paper.
let's
and
stop
we're
right
very
there.
close to
Okay.
winter
As
break.
soon as I saw the top line, I started looking for the bill to see if I had the right one. So I didn't finish reading the sentence.
What
My
matters
fault.
most is that you're a champion and you care about making sure, right?
Oh gosh, thank you. Okay, moving on.
Others, questions? All right, well, I actually want some clarification for myself, a better understanding. What exactly is, or remind all of us what categorical eligibility is so that we're being clear, because this is a really thick one, folks. So if we could really look at it, I mean, it's bold, I think it's important, but I just wanted us to really understand what is category. So I'm asking staff to tell us a little more specific about what that is.
I can jump in here. So, I mean, the kind of broad description of it is in the recommendation where it's basically instead of having an income, I mean, you have the income limits and requirements, but certain categories, if you are eligible for one benefit or one program, then that would make you eligible for childcare scholarship in this case. So it has to do with making someone who's applying automatically eligible for the program because they are receiving benefits from another program. So it makes it so that the agency wouldn't do the same income determinations to see if they're eligible for this program.
And so it keeps people from going from agency to agency to agency and, you know, kind of streamlining the process to receive supports. The one above it, could you also talk a little bit about presumed eligible and what that bullet does?
I believe with that one, I think MSD could shed a little bit more light on this as well. But I think the idea there, unless Emily, do you want to jump in there? Or?
My understanding of presumed eligibility is that it is, I think they have it with Medicare. I think the way it works in that situation is if you go to a hospital and you are not signed up for Medicare, a staff member is trained to kind of sign you up for 60 days based on the information you give. And then in that 60 days, you have to apply for the full, coverage under Medicaid. So I guess the idea might be that something similar would work here.
And I will say that we heard this also earlier today from Delegate Solomon. There was a little bit of a back and forth with MSDE And we discussed this yesterday as well. It is not 100% clear that this is something we can do with the subsidy program, but there has been a lot of research taking place to determine if it's something we can do. Our hope, the reason it's worded this way in terms of exploring the possibility is we are very hopeful that this is something we will be able to do with the child care subsidy program. It works well with other programs, but we have an understanding that there needs to be some T's crossed and I's dotted to ensure that that's something we're able to do under the federal rules.
And also one of the T's crossed is what happens if we provide a benefit to someone and then they're for 60 days and then they're deemed ineligible. And
right, the process questions that
clawback when it comes to funding for a state government is different than clawback for individuals. So I think that that's also was something we wanted to think about. So rather than strongly saying we will do this, we do need to explore it. I see Delegate Smith, you're shaking your head that you think that that's a good. Okay. Great. Others? I guess I am going to ask Delegate Ebersol on this last bullet. Do you think that sort of goes with some of the discussions we've been having about, other like camps, and are we starting to looking at licensure requirements for something other than childcare that sort of looks like childcare, but for older adults?
Yeah, this one's broader, obviously.
Yeah, it is, yeah.
You and I have had discussions about the possibility of for people who aren't actually going to be doing pre-K, who are doing outside of school hours.
Yeah.
We might add that in, that beyond the school day hours certification, because that's something that we've had requests that it's difficult to get people who aren't actually going to be teachers to get certified to come in and do after school childcare, wraparound childcare.
Right, but I just wanted to, if we can leave this as it is, but this is definitely a topic that we explore. Okay. All right, Delegate Kelly, I don't see any others.
Sounds like we have a lot of support, and I think these are some pretty specific recommendations. I believe we're going to do some sort of official voting over email so that the members who had to hop off this call or couldn't make it can weigh in. But thank everybody for their feedback in this conversation today, and also really for their hard work and great questions all interim. I think we made some really specific progress in moving the ball forward, particularly in the childcare space. This is such a critical issue, and so many people have been really struggling, both childcare providers and families that use childcare over the last couple of years. So I'm really excited to see the work that is taking place in this space, in large part due to the efforts of the members of this committee. So thank you, thank you, thank you.
Okay. All right. Well, I will, if there are no more questions and then there's no more work to be done, I will say that we are officially, I'll take a motion for adjournment.
So moved.
All right, second?
Second.
Okay, we are adjourned. Everyone have a great weekend.